What's up, everybody? Some people say Columbus Day. We say Indigenous Day. We represent what we feel. We're here at the Real Talk Chronicles. I'm your host, Bill Ford, with Dr. Corder. We are glad to see you in the building today. I hope you had a wonderful weekend. I sure did. I'm tired, and but I'm good tired. That's a blessing. You know what I'm trying to say? Like, people don't understand.
Yeah.
It's good to be feeling something at any time in your life. This is a month that I think it's Breast Cancer Awareness Month, and then, of course, I asked the doctor definitely to elaborate on that for you out there, and especially for men too, that you have somebody in your life that has experienced this or going through it right now as we speak. Some people are survivors, and I think it's important that you get the best professional. So with that being said, first and foremost, my cousin, Dr. Corder, how are
Hey,
you?
fine. Can you hear me?
Hear you loud and clear. Great.
Okay, because I was kind of getting choppy when I was listening to you. But hey, long time no see or hear. Welcome, welcome. It was so much we could have talked about, and you're right. October is Breast Cancer Awareness, and we have tons of folks that I'm aware of who have been diagnosed, are breast cancer survivors. We have lost some. One thing about the statistics is that we, as people of color, women of color, well, men as well get breast cancer, but women of color tend to have a diagnosis that is more, I want it significant and severe by the time they have a diagnosis. And sometimes because of that, often because of that, the survival rate is not as high as Caucasian women. But it's so
Mhm.
important to get checked. It's so important to do self exams. You're not going to. Most of my friends and patients who have found a lump, or rather who have breast cancer, they found it. And then there's something called a mammogram, and I always tell folks, look, get two mammograms. That first mammogram or that one mammogram that may say is negative, yeah, get another one. Sometimes you have to get a sonogram dependent upon the density of your breast tissue. So I would go second opinion at all times, especially those who have risk factors. There's genetic risk factors, and that's certainly something that people need to talk about their family history, and people and family members need to talk about their history, their medical history. Some people keep it, to themselves, or don't tell anybody, or people may not know what Aunt Sally died from, but that information will give you insight and is helpful and often life-saving. So I'm going to stop at that, because I don't know if there are any questions, if anyone wants to add to it, but we need to be aware our breast is part of our body, and we need to be aware of our breasts in terms of the density and any lumps or bumps, etc.
Right. So shout out to everybody that's chiming in. Stefania, Michelle, cousin Kendra's in the building. Um, uh, Michelle said, I found my lump in 2000. Immediately saw the doctor the next day. Wow, that was good that you were able to have that kind of health care to get to see your doctor that way. I hope everything is all right, unless you want to give us some insight, because a lot of times the doctors here, I can only sympathize and equate, having my mother-in-law that went through that. Thank God my personal mother didn't go through that, but of course, Malika's mother did, and because of that situation, Malika has to get checked out. I think like doc, once a year, something like that, because like you said, that's a risk factor. So I
Right.
think, and you said also something too that was very important that we didn't know. You said men can get breast cancer.
Yes, yes, they can. I have a friend who died of breast cancer. He happened to have been a surgeon. Men can get breast cancer. Of
Mm.
course, that's the last thing you want, a diagnosis, and the last thing you think of, unfortunately. But men can get breast cancer. I said I have sometimes patients who have, you know, lumps, etc., and I'll send them to the surgeon. Now, there's something called gynecomastia, which is a big word, that adolescents, when you're developing, when the males develop, they get a little breast tissue and then it goes away, but it should go away. So when there's breast cancer in the family, male and female, when female breast cancer in the family and the males have a nodule or some type of lump, etc., please don't ignore it. Please make sure that you rule out breast cancer.
Now, is that just even from, I know as men sometimes say they get older, they get men boobs or something like that, or is that because that's hereditary too, cancer in men?
Well, the man boobs are technically just because of fat tissue, etc., as they get older and they lose that muscle tone. But there's something called nodules in breast cancer that you don't have to be elderly. Often you're 35, 40 years old and get it. Now, of course, no matter what age, as the doctors check you, but always keep in mind, especially if you have breast cancer in your family and you being a male, make sure you mention that because those are what we call risk factors. Now, there's certainly something else that I need to mention, especially now that weed is legal. But even when it wasn't legal, I would mention it. Marijuana would give men breast.
Okay.
And one of the things I used to talk to my teenagers years ago, I was like, you better stop smoking. Otherwise, you may as well go ahead and order a bra.
I'm sure they didn't like that. I know they didn't like that.
And they're like, what? I said, no. I said, here's what happens. You're smoking a lot of marijuana. The breasts will get bigger and excuse my expression, and your balls will get smaller.
Yeah.
So,
and I don't think I can speak for all the men. I'm sure in this situation, no man want to hear that. You know what I'm saying?
Right. That's right. So sometimes that's all it takes is like, well, I'm gonna slow down, doc. But honest. So yes, you will see increase in breast tissue when you doing a lot of weed smoking. But meantime, you just got to get checked. One of the things we got to get checked. We got to get pap smears and all that. So you men, make sure you're getting your breast exam as well as your prostate. I know we're not talking prostate cancer, but we need to also make sure that they go to the doctor and get a thorough checkup. If your doctor is not examining you in a thorough way, then you need to change doctors.
Everybody, that's a real talk moment. Listen, you heard what the doctor said. If your doctor's not examining you, then you need to change doctors. How often should a woman get her breast checked out, doc?
Well, you do self-exams and you do that when you're in the shower, etc. But as your annual checkup once a year. But then, if there's something that is suspicious on any of the tests, the mammogram or the sonogram, or if you find there's something, then you have to get checked as soon as you feel either the report is unusual or you feel that you feel a lump. Now, there's something called fibrocystic breast. I must mention that. Especially in women of color, we get fibroids as well as we get fibrocystic breast, meaning that we get these little nodules. They're not cancer, they're tumors or so in your breast. And some people, they get tender when you're on your cycle. They're hormonally responding. So you'll hear sometimes the doctor will say, well, I'm examining the nodules or examine the lump because I may feel a lump. And I tell them, you're going to see a breast specialist, which we have one of my colleagues. That's all she does is breast evaluation and breast. She's a surgeon, but she's a breast specialist. Well, anyway, I may send them and I get a report back saying that they have fibrocystic breast. And that's okay. But that doesn't mean that even when you feel a new lump or that lump, you still should get your breast examined annually.
Everybody, you listening? This is knowledge. Michelle has said after she found it, she said after a biopsy, it was cancer. I understand. Went removal tumor, and had radiation treatment. She said it was scary. Yeah, she said it was scary. She also said, know your body, check your body. What's up, Vanessa? How are you, sis? She said, hello, everyone. Just checking in tonight. Yes, this is an important issue. I lost one of my favorite aunts years ago to breast cancer. My family was devastated. Thank you for this discussion. Absolutely. Michelle also said, I do self-exam all the time. It was the person to take, it's what did she say? I can't see it from that point. She said, the heart is in the way. Let's see. She said, it's up to you to check your body, the person to take care of your body. Absolutely. And I think a lot of us, Doc, especially with people of color, we like to self-diagnose and self-medicate ourselves, right? I think that's the last thing you need to do when it comes to breast cancer or cancer, period, or any illness,
Yeah, you don't want to hold. You don't want to wait out. You know, I don't want you to be claustrophobic. I mean, not claustrophobic. I don't want you to feel like, okay, you know, I'm gonna everything I have, and I got cancer here, I got cancer there. But at the same time, you want to make sure that you check yourself, get checked, and don't be so fearful of bad news. The bad news is if you don't get checked, it's gonna get worse.
Yeah, because it spreads, right?
Right, of course. And a delay in any type of cancer, it can result in death, early death. So you don't want to, go and say, okay, well, I'll just put it off. I don't want to know. Well, I know you don't want to know. You don't. No one wants bad news. But the earlier that you know, just like you're listening, your guest, earlier that you know, the sooner that can be behind you and you continue to live a full life.
Understood. Kendra M said, in Arizona, I was given the generic testing for breast cancer due to a strong family history. I'm grateful for proactive providers. Absolutely. Vera with the wonderful last name Foster in the building. I see you too. I see you, Michael Bunn. What's happening? Shout out everybody. This is Real Talk Chronicles. That's Dr. Marilyn Corder. I am Bill Foster. This is Real Talk with Dr. Corder. We're talking about breast cancer right now because it's Breast Cancer Awareness Month. But if you have any question, please feel free to type it in and ask the doctor. If you know anybody that um, is going through something like that, I understand with social media and podcasts and things like that, a lot of people are not privy or they don't want to divulge certain things. But listen, man, you better ask right now while you got a doctor for another 30 some minutes. You know what I'm trying to say? Or, I mean, be honest, or 40 some minutes. You better ask because anything. Um, uh,
May I say something? So
oh,
look,
it's your show. It's your show,
okay,
please.
so look, so you can be in your 30s and have breast cancer. And this is
Mm,
why we've lobbied and lobbied about that age of 50 or 55, whatever it was, that would be could be your first mammogram. Please, I know 3 4 young people less than 35 who were diagnosed with breast cancer. So a lump, no matter how old you are, it needs to be evaluated. If you have any questions, if you have family history, forget what the criteria or the standards are. That's your life. So fight whatever you have to do, the doctor, and say, listen, I don't care, you know, insurance may or may not pay for it, but you got to get that mammogram done. So
right.
don't
I got
think, don't think. Go ahead.
a question that came in from Why Russell Works. It says, "Hi, Doctor and Bill. My teen son had a lump this past summer, but it went away. His parental grandmother had breast cancer, so I'm concerned. Should I have him examined?"
So that's what I was saying earlier. Through puberty, the teenage males will get what we call puffy breasts, or they'll get breast tissue. And that big word is called gynecomastia, which sounds crazy. But anyway, it means that as their testosterone, as their hormones are doing its thing, it also can and often will, in 50%, have breast tissue, and then it resolves, it goes away. So that was the operative phrase, it goes away. Now I'm not going to say don't get a follow-up and just say, look, doc, make sure it is gone away and that it is just what we see through normal development through puberty in males. So great question. And often, and when he said it went away, because that's what we say and that's what we check. And when I see a young man going through puberty, the levels of puberty, we always look at it as 10 or 3, 10 or 4, and that's when you have the puffy breast. Finishing up puberty is 10 or 5. It's just our rating scale. So when I tell the parents, I said, this is normal and it's tender and all that, but I want to see you in 6 months, and I definitely want to see you in a year. That way they know, and I know as we make notations that this is what we're calling it, but at the same time, we want to make sure that that's all it is.
Yeah. So okay, now that's Yvette Russell. Now that's my Yvette. Now I know who you are. You had the name different, so but now I know who you are. So she said, "Thank you so much. This is thank you for this information. So helpful." My
Mhm.
boy Mike, who used to be the official photographer for Real Talk Chronicles when we did the live broadcasting and stuff like that. It's good to see you, brother. He said, "Are there any other tests other than mammograms to determine if a person has breast cancer?"
Yes. So that's a good question. So there's a mammogram, but there's a sonogram. So mammogram, I call it. level one of an exam or test for breast cancer. But often you can have a mammogram that will be negative, but you can still have cancer. So I always tell folks have at least two mammograms and a sonogram. A sonogram is
You back? Hold on. Hold on, everybody. This is Real Talk Chronicles. That's Dr. Marilyn Corder. I'm Bill Forster. I don't say, Doc, I can't hear you. We don't have you on the volume. So right now we're talking about Breast Cancer Awareness Month, and we have Dr. Marilyn Corder, a world-renowned doctor in this world, and she is giving us insight for women of color and just women in general. I mean, the statistics don't lie. She's just giving some information right now. She's on the phone. She's just giving some information that men can get breast cancer, women can get it. She can break down the statistics for you if she knows them by hand. I mean, I still can't hear you. Right. So right now we can recap really what she said. She was saying first and foremost that once a year you definitely should, of course, you should get checked out. Women, I think she said, correct me if I'm wrong, anybody that's heard her, that women can get it very young in age too, which is something that can be scary. We also know if you don't do anything about it, cancer can spread. So I know that from my father having prostate cancer, and then it spread to bone cancer, and that was ultimately took his life. So cancer runs on my father's side of the family. It doesn't run on my mother's side of the family. Dr. Corder is on my father's side of the family. I will bring her back in and see if we got her volume check. Can you
am
hear
I
us?
back? Can you
Yeah,
hear
we
me?
got you. We got you. We got you. We got you.
Okay.
Definitely. So
Okay.
yeah, I was just letting the audience know that cancer
Mhm.
is nothing to play with. Cancer runs on our side of the family, which you're on my father's side.
Right.
Breast
But
cancer.
let me also I have to finish that question. I apologize for the interruption.
Oh, no.
Um, the question was what are the tests? So mammogram, okay, sonogram, but biopsy. If there is a lump and feel like a grape, feel like a nut, peanut, whatever, then one test is something called a biopsy, which is taking a little needle and aspirating it. You go in where you are, and we make markers so you know exactly where that area is, and it's a procedure that you're not going to need anesthesia. They numb you, and you take a sample of it. That's what we call a biopsy. And that way we know. And then once if let's say it's negative, okay, but let's still take it out. Let's say it's positive for cancer, you definitely have to take it out, and you have to take out what we call that's called a lumpectomy. But you don't need a mastectomy in many cases, but you want to make sure, and I emphasize that they not only take that lump out, but they take a larger area around the margins, because what you see as a cancer nodule or mass or tumor, what have you, it's there, but you know what? It does touch out certain places, and you want to make sure. And as the surgeon will do, they won't just limit it to that little nodule. They want to make sure that they take enough around it to minimize that it has spread. If that makes any sense.
Yeah. So basically, they're taking more than what they
Right. Than what the lump shows you.
is. Yes. 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 So you said a lumpectomy.
A, lu-
That is basically a removing of the lump, correct? Is that
a
it for?
lumpectomy. A lumpectomy. Now, some women will say, I don't want to have a mastectomy. Mastectomy is taking the whole breast off and getting
Okay.
what we call revision, um, breast tissue, new breast tissue, what have you, cosmetic rather, correction. But you want to make sure you're alive. And I always say this, I know we don't want to lose our body parts, and some women feel that their breast makes them the woman. It doesn't. But, and if you're in a relationship, some people will feel, well, he won't love me or she won't love me, whatever it's the case.
Yeah,
But if that's what is keeping them there, then they need to be gone before your breasts are gone. Okay.
absolutely.
So,
Yeah.
okay. So it's like, come on now, and some women put it off because, and they're like, well, I'm gonna be disfigured and my husband won't love me. And it's sad to hear that, because then those folks have waited a little longer than what they needed. And I've had some people come and at the last minute, I mean, years later, where the breast is just leaking. I mean, it's just awful, and it's just too late. It's too late for surgery and chemo, and it's just palliative care, meaning that they're gonna die because they waited so long. And and that ends up happening. So you just can't do that. I mean, I tell you, and we have folks who are so on it. When I say on it, they have a breast lump, turns out to be a breast cancer tumor, and they're like, look, not only take the one, take the other side too.
Yeah.
Because
Isn't that something
because
like Angela Jolie did something like
right,
she had,
Angela Jolie. But and my dear friend, Aquanetta Fraser, a lot of people, they're like, look, because that other side may not show anything. And it turns out 20 years, way before Angela Jolie, I have a dear friend who the doctor said, oh no, we just can take this one. That other side is not doing anything. And she said, no, take both. And you know what? At the end of the day, when they sent both breasts for pathology, what we call the report, that breast that wasn't showing anything to the naked eye or to the to the field of the exam had breast cancer.
Wow.
So
Wow.
I tell everybody, your breasts are twins. They're twins.
Yes. Yeah.
Okay.
Yeah.
Oh, and why go through
Understood.
surgery twice? Why go through surgery twice?
Yeah. Like I said, I think like a vanity a standpoint, a person probably wouldn't want to do that. But for a health issue, if it can add years to your life, it is what it is, right? Because I mean, I'm sure you can get a false chest. You know what I'm saying? It's something right now. I mean,
And the
modern
plastic
technology.
and the plastic surgeon, honestly speaking, if they're gonna make and reconstruct the one side, look, have them babies even out. Have it on both sides. That way it's one time. Okay. I've
Yeah.
seen
Yeah.
some I've seen some good looking breasts, especially when it's bilateral at the same
Yeah.
time. It's like, whoa. I mean, you don't see scar tissue, etc. So if it's your vanity, then fine. Just say, look, let me make sure and check out the doctors that they make good breast, as they taking out the breast tissue.
Yeah, modern technology. Yeah, and I guess you pay for what you get to. So I mean, healthcare. It is. Shout out to everybody that's chiming in. People got some comments and questions. Let me see. Let me go back a little bit. Uh, Yvette has said, referring back to that lump that she said she found out. She said not for her, but I think it was for. Let me go back. It was for my teen son. She had said. It was it wasn't puffy. It was just a hard spot under his left nipple, which
Oh
I think
yeah.
that she said
Oh
was
yeah.
scared.
So that's the breast tissue. We call it like a coin right up under there. And that's it's kind of breast bud. That is true gynecomastia, which is a normal thing, but still get it checked. So that's a good thing that it was just that. And it's often tender and it's often one side before the other side comes up.
Mm. Michelle said, "I want to ask the doctor, what's the best way to have our loved ones to have checkups? They think they think the doctor is just after getting on our income." Hmm. I guess she's talking about
So
a male or female. Yeah, anybody that I guess, especially people of color. We've always known years ago that men try to be so macho, and I'm not going to the doctor, this and that. Listen, right now, I keep my doctor on my favorites in my phone. You know what I'm trying to
mhm,
say? Because
right,
that's
right.
for your best friend. So the question is, I want to ask the doctor, what is the best way to have our loved ones to have checkups? They think the doctor is just after getting an income.
Right, money. And I get it. Here's what you want. If it's somebody who is truly dear to you, you just tell them. You may not love yourself enough, but I love you more than, which obviously, than you love yourself, and we want you around and get checked. You hear stories all the time, and I'm gonna also say this. Medicine is a little different now,
Yeah, yeah,
and doctors are burnt out, they're stressed, etc. I'm gonna be retiring soon. I put in my 45 years already, but
right.
you want to make sure that whoever you see in, they're thorough, that you ask questions, go in with your questions. If they don't have enough time, then make sure you say, well, can I text you back or telehealth you back or whatever. But you
Hmm.
have to make sure you are your own advocate. Please, please be your own advocate. So I'm
Right.
going to add two more things. So, if you nursing as in breastfeeding, that decreases your chances of getting breast cancer.
Really?
Oh, absolutely.
Wow. Ladies,
Absolutely.
that's a real talk moment. Maybe you say that again to them for them, doctor,
Yeah.
please.
So this is how I get my moms, expecting moms, and brand new moms to understand. They're like, I don't want to breastfeed. I don't want. I said, listen, it's the most natural thing to do. And when you look at the statistics, the you lower your risk of breast cancer significantly if you breastfed. Okay, minimal 6 months if you breastfed. Now, of course, if you breastfed, not only do you lower your chance of getting breast cancer, you also increase your uterus contraction. In other words, it's like doing sit-ups while you're nursing. But nonetheless, the benefit, of course, we know about how extremely beneficial breast milk is to the baby. But it saves your life too. So then when I start saying that, they're like, "Oh, really? Okay, I guess I'll breastfeed." I'm like,
Wow.
"Yeah,
You know what's so funny? I'm gonna put out a historical fact, and I put it on social media today. For those that follow me on social media, I try to give a little quiz, and then I try to do some historical stuff of people of color, and then I try to give some spiritual stuff and a little humor, because I don't know where you are in your day, and some thought provocative affirmations. I just realized that, Doc. I don't even know if you knew this, that in slavery times, when they wanted the slave masters wanted the slaves to breastfeed their babies, they had
right,
this they had this breastfeed out of one side of the breast, because they didn't want to, like, they didn't want them to breastfeed out of the same side that the African American babies breastfed out.
right."
I did not know that, because, and I forgot. I put it on my wall. If anybody wants to go see it, please go look at it. Um, it's something. It just mind blows me when you find out everything during certain times. Vanessa, what's up, sis? She says, I know this is a prime issue on breast cancer, but I also want to say lung cancer is also important to know. I lost my mom to lung cancer through secondhand smoke. Wow. You know, um, Cancer in its whole entirety is just something paramount. I mean, the one thing that about Real Talk Chronicles, we're really not scripted, but I just figured that breast cancer is something that was important to everybody, because women are just vital people in this world, and I wanted to bring it up. But like I said, if you have a question, Vanessa, about second of cancer, and you want to ask the doctor, please feel free. Hey, Doc, let me ask you a question. Everybody now, and I'm not even talking about the CBD aspect, but every marijuana is legal now. Oh, she's on the phone. When she gets off the phone, I just wait till she gets back. But everybody, this is Real Talk Chronicles. The one thing I want to ask you, please, can you share this to your social media pages or to your friends? You can text it to them. If you're watching it from YouTube, please subscribe to it and like it. I'm trying to give everybody the best content. You know me. Some of you know me from all different aspects of this world: promotions, martial arts, law enforcement. But the one thing that I'm doing right now, that's the evolution of me, is giving you this kind of content. And I'm happy to put this podcast on, and it's my baby, and I love it, and I love the fact that my cousin, for those that don't know, Dr. Corder is my cousin. You can Google her. She's official and with so many different aspects of health. She's been doing it, like you heard it just say, she's been doing this for like 45 years. Her and her husband are the bomb. You know what I'm saying? I went to old school words. They're the bomb. You know what I'm saying? But Vanessa,
So
you
let
had a
me.
question? Go ahead,
Can you
please.
hear
Go.
me?
Yeah, I
And
got
I
you.
know, and I know I'm supposed to be on to 8, but somebody's stranded, as in the other Dr. Quarter. So I got to grab him in a few minutes. He's on the road. But
Okay.
two things. Going back to the listener, lung cancer is, of course, we know, dear to me as well. My mom died of lung cancer.
Yep.
She smoked 30 some years,
Mm-hmm.
and I guess we don't smoke cigarettes as much now, but we smoking like vaping and smoking weed, and that's still going to your lungs. So it is certainly something that we need to talk about and address.
Mm-hmm.
And if it's a diagnosis of lung cancer, chemo, And radiation will prolong your life for sure. Okay. But I remember when that diagnosis came for my mom, and she was in her 80s, and then we did everything we could do, chemo and radiation. And I say all the time, I also gave her some CBD. That was before it was legal,
Yeah.
and I
Hmm.
extended her life 5 years. So I believe in homeopathic as well as traditional medicine. So I wanted to
Right.
just make sure I added that.
Right, Doc. I'm gonna read this thing, and you let me know when you ready to check out, because like you said, you just have something
Right.
that you have to do, and I
Right.
understand that. And I'm so appreciative because I know. Let me tell you something. There isn't anybody more busier than a doctor sometimes, and my cousin, she handles it all the way around. She handles family, uh, husband, kids. Let me tell you something. Practices and she's always accessible. She's given out her email number, her email address to all of you before if you listen to any of the shows. And so she gets back. She gets back to you. So
Oh.
if she says she has to go, then I'm gonna let her go because I ain't know. First and foremost, she older. He my older cousin, so I'm not getting at the family reunion. I ain't getting cursed out.
Well, I can. It's not dark. I can do 5 more minutes. I can do
Okay,
five more
you let me
minutes.
know. Michelle
Okay.
said, she said, I had part of my lymph node removed also. I now have a dent in my breast, but I don't
Yeah.
care. I'm alive. Absolutely.
Good girl. Yep.
Yeah.
Yep. Yep.
You
Yep.
know, shout out to Paula. I see you, Darren Collins. I see you in the building. Anybody, if you got any questions, please give them to me. I'll ask them to the doctor later, or like you said, come
Hmm.
back. This post is on social media and Facebook. It's on YouTube. YouTube probably we won't see it after, but on Facebook if you chime in. But please stay on YouTube, but subscribe to it. Doctor also has a show, Village Talk. Doc, tell them where they can listen
Oh
to
no, no.
you.
So I just retired. No, I forgot to update you as we update live. So
What?
I I retired from Village Talk. I
Get
do
out of
some local
here.
things. Yeah, 25 years.
Mm,
25 years. And I do wellness Wednesdays. I do some things for HUR, Howard University, but I
yes.
no longer I passed the baton. I'm like, that's it, Dr. Cord. We just did that in July. So yeah. Yep.
Wow.
Yep.
Because
Yep.
I was wondering when we had some police issues, I didn't get a call, so I
I
just figured
know.
I
Don't feel bad.
said, no, I was like,
Nobody.
wait,
That's
well,
right.
listen, you ain't retiring from Real Talk yet. I'm gonna put up some resistance on that. You can retire from a lot of other things, but I'm not letting you go on that. I'm gonna have to throw some family law
Uh-oh.
up in there. You know what I'm saying?
Uh-oh. I got you. I got you for a while. I got you.
Um, let me just see. My man James Palmer, he said, "Great interview, Mr. Forster. Information is key. Thanks for sharing." Exactly. My brother Darren Joseph said, "Can the doctor give information on regarding open my I don't want to tear this word up. Myomectomy.
Wait a minute. I got to
M
spell.
yeah.
What?
My Myomectomy.
Myomectomy?
Is that
Oh,
yeah, he's
is that his
yeah.
back? Is he talking about myomectomy in terms of back evaluation? Because sometimes what happens when we have back pain, we get a myomectomy that will evaluate the extent or the cause of your back pain, if it's neurological, if there is a tear at your spine, different places. So is that? I think that's what it is.
Yeah,
So
yeah.
myomectomy.
He's saying, well, I need to. We'll talk sidebar, or if you had more
Right,
time, I'd have talked about that too, because
right,
definitely I have back issues with that, and
right.
that's something I didn't know about that, and I have to go see a neurologist on some other stuff too with my back and things like that. But like I said, we'll talk sidebar. But see, the one thing about Real Talk Chronicles, I'm transparent with it, and everybody don't get it twisted. I still got a good hand game. My back ain't that bad. You know what I'm saying? But he said regarding fibroids.
Oh, myomectomy.
Yeah.
Myomectomy. Oh, that's, you know what? Duh. You know what? I'm thinking, okay, myomectomy is what we can do now without having what we call a hysterectomy. So myomectomy is an actual procedure that the doctors go in laparoscopically, so they don't have to make the big cut, and take the fibroids, they visually look at them, and they squash them. It's almost like they go from a big grape or whatever to nothing, and then that they remove them. Now, what we now also have is the is the one where we have the actual blood vessels of the fibroids. We snip those now, and then they will then just dissolve on their own. Now, I've had both. I'm the fibroid queen. I have had the
Mhm.
myomectomy, which is a little bit more extensive than the actual intrauterine
Mhm.
vessel ablation. So that's more new. The myomectomy still keeps your uterus, and as it keeps your uterus, you can have babies. You can have babies. Okay.
Mm, mm.
So that's for folks who want to get rid of their fibroids, but um, want to save the uterus. So, and that's an easier procedure. Um, and we see that a lot. And it's less time. It's less time down. Like a hysterectomy is a little bit longer. It was not. It's maybe 6 weeks versus a myomectomy is like 2 weeks, and then the intrauterine blockage is 2 days. And
Wow.
so I can speak on personal with the from the myomectomy
Wow.
to the intrauterine artery obliteration.
And everybody out there, matter of fact, Doc, if you don't have a topic that you want to talk about next month, then maybe
Uh-huh.
we'll go down that fibroid conversation if you want to, unless you don't have something else that you want to bring to the table.
Well, we can we
I
can
don't
do.
know.
Well, that's fine. It's something that we need to talk about more anyway. As Black people, years ago it was like, soon as he had a fibroid, oh, we're gonna take a uterus out. No, you don't have to. But as long as you're going to a doctor that is knowledgeable of the options to treat your fibroids.
Yeah, yeah. Let me ask you a question. Do you know the statistics before I want you to pack up and get safe.
I'm
Um,
like,
uh, uh, what are the statistics for breast cancer in women of color? Is it more than the average our other sisters of
well,
different ethnicities?
we see breast cancer more often than we did 10, 20 years ago in Blacks. I contribute some of that breast cancer. I mean, this may sound weird, ladies. The nail polish, the way they do that gel and scrape that nail down, your nails are porous. And guess what's on the other end of your fingers? Your breast. And different chemicals and toxins ascend, meaning go up the vessels to your breast. The other thing is harsh deodorant, aluminum. Many of your deodorants have aluminum, which
That's
is like
Malika's thing. Yeah, she
anti,
always talk about it.
right,
Yeah.
it's antifreeze. So years ago, people say, people say, how come we start getting it more? Because we're using those strong deodorants. And the sad thing was shaving, and then right after we shave, we put deodorant. So it's like wide open, and then you're putting all this deodorant on, and it's going right to your breast. So there's an ongoing joke I have with my colleagues. No offense to anybody, but there's some cultures that don't believe in deodorant, but they living longer than we are. We all freshed up, no hair, and deodorized. So a little bit of little bit of onion under your in your nose from no deodorant. That person can live a lot longer. So it's all
listen,
good. So watch
listen,
watch your
everybody.
fingernails.
Listen, everybody. I'm gonna tell you this is real talk. Dr. Corder almost got Malika some verbal tongue lashing one time. She was telling me, "Oh, Marilyn said, don't." I said, "You're not going out this house without them deodorant, young lady." You know what I'm saying?
And you could get the natural deodorant. So you could get natural deodorant that doesn't have
That
the
Tooms or
toxins.
Toms or whatever it is.
Toms, and then you can also get there's Highlands, there's a couple brands, but you can get the Stone. There's a Stone that will slow down in terms of the odor under your arm. But check out the nail polish. They just had a thing where it causes cancer. The nail, I don't get gel. I got and you can get the natural nail polish and take that to your salon. So that if
Mm.
you want to have your nails done, I get it, but you don't want to die for your nails to be looking done. As I say, you'll look good in the casket. So just have them when they lay you in the casket. Put your hands up like this, because they say, "Oh, she got her nails done." Okay, so just
He'll
show
be
them
casket
nails.
ready. He'll be casket
Okay,
ready,
that's
right?
right. Okay, but I gotta go. Love you
Doc,
guys.
I love you. All right, everybody. Michelle said thank you for you and your cousin for sharing great information. Mark says always so much information she brings. Thank you and your blessings. Doc, my man James Palmer said the same thing. I'll talk to you later offline.
Okay,
I love you.
gotta go.
Get home safe.
Bye, guys. Be safe. Bye-bye.
Everybody, I'm gonna rock out with you for a few more minutes. You know what I'm saying? You know, listen, please share that information. Shout out to everybody that's chimed in and came in late. You can go back and watch it on YouTube or Facebook, whatever. Let's help build the YouTube content. There's so much going on. You know, give me information. Malika said, I've been using Humble all natural deodorant. Thank you, Dr. Corder. Malika, you call it yourself. I don't want to talk about that. You know what I'm saying? We laugh about that all the time. Long as when we go out for a long day and we at the brunch party, you make sure you put on some regular deodorant. We ain't got to use this and all that. Just ain't nobody going to say my wife smell a little tart under the arm. Each and every natural deodorant. Yeah, I mean, listen, I'm from the school where my parents used to be like, yo, you can put baking soda under your arm. I was like, really? I was like, it don't stay. I didn't know if you had to wet it or something, but remember baking soda? You'd be like, blah, all a bunch of little powder, mess up your shirt, got a little white stuff under you. It is what it is. Hey, But listen, sometimes with health comes great vanity sacrifice. Somebody's like, oh, you're pretty, but you don't have cancer, but your arms stink. I don't know where I'm coming from with this, but it is what it is, But like, oh, your arms is tart, you know what I'm saying? But your shirts are stained. Y'all know what I'm talking about when you get the little white, the yellow under the white shirts. You're like, oh, like, oh, I'm cancer free, but I gotta buy a new shirt every 3 weeks. I'll buy a new shirt. Don't mind me. Listen, any content that you want me to cover, please. Most of you have my personal information or find a way you know how to reach me. Write it in, talk about it. I will cover it with the doctor, especially for the men. If you need me to bring a male doctor on, I'll get her husband. With Dr. Corder, the Corders, they keep it 100. They don't have any problems talking about any conversation that they want to. And then they cover it from an aspect of especially people of color. And for our Latin sisters and brothers, don't think that it might not trickle down to you some way, somehow. But the bottom line is, even for people that, because my friends are very broad, you can ask about anything else. I mean, the bottom line is health is health. It's no discrimination in anything that we hold against an Italian or Irish person. So please don't feel intimidated not to ask the doctor a question. She will answer it because she's a doctor. That's her profession. She took an oath just like we all did. Vanessa said, thank you so much, doctor, for the 411. Knowledge is power. Baking soda is all good for underarms and for your gums and toothpaste. I still use that for my teeth. Let me say, I'm gonna get the brushing. I'm gonna use some baking soda too, because let me tell you something. I ain't seen anything. That's like the powder bleach. You go out. There's some people that just, you can't help it. Baking soda or anything, they just need it. But baking soda is right on the money. So coming up, please, if there's any content that you want me to discuss, topics, a lot of you inbox me other things and stuff like that. You all have a pipeline to me. You know how to reach me. Give me the information. I want to talk about the things that you want to talk about, because that's going to make you listen, and you're going to tell your friends. Like I said, we're still working on some stuff on how people can call in or send emails or conversation to be able to converse with us while we are live. I think that is great, because a lot of people don't want to come on, and I understand that, but definitely calling in, and while you're in your pajamas or you're sitting there drinking your hot toddy, you can just reach out and kick it with us. I'm not going to force it. Let's see, what do we have going on in politics? Migrants, Speaker of the House situation. Uh, I heard, I don't know if you've heard yet. It's going to be out. I'm going to tell you right now. Breaking news. There was an officer that was with a hospitalized prisoner. Right? It's not uncommon. You've seen it all before. Officer with a hospitalized prisoner for whatever reason. So the doctor tells the officer, okay, well, he's released now. He can go. This officer, he decides to let him go. He takes him outside, cuffs off, whatever. Okay, bye, Jimmy. See you later. He doesn't take him back to the precinct. So now he calls for a car to come pick him up from the hospital. The car comes and they're like, yo, where's your prisoner? Oh, I let him go. The doctor said he's released. Well, I'm sure, and I'm sure you all can agree that dude needs to call his old job back and see if he can get back to that, whatever he was doing. If it's flipping burgers or packing groceries or whatever he was doing, he needs to go back to that, because obviously he is not built for law enforcement. And this is just public service announcement, FYI. If you think about going into law enforcement, or somebody in law enforcement, if they're ever on a hospitalized prisoner and the doctor in the hospital says they're discharged, it doesn't mean you let them go there. You take them back to the precinct to continue their processing. I just wanted to put that out there for those that don't know but think they know, because you never know. Also, too, I want to give you a little insight on something that I received. Give me a sec. They are taking examinations, filing for jobs for conductor for transit. Exam number 4600. Application deadline is October 27th, 2023. Type of test, multiple choice. Don't let that confuse y'all. It's multiple choice. Most of us is on the retiring side of things, but for those new, application fee is $68. Wow. I remember when we took a test, $25 or $30 or whatever. Multiple choice test date, Saturday, April 20th, 2024, or Sunday, April 21st, 2024. Job description, if you don't know what that is, under supervision and responsible for the safe, timely, and proper operation of the MTA, New York City Transit trains in customer, yard and work train service and customer service. They open and close doors, make proper announcements to customers, and set up the automatic announcement system. While in road service, they interact with the train operator, supervision, and the control center when necessary. They provide flagging, protection service duties, such as settling work on or near trainways. Basically, you're a conductor. Don't get it twisted. It's so fluffy. You know, when you get a job, you go fill out for a job, they give you all this. You'd be like, oh, wow. Then when you get there, you'd be like, oh, I'm just a conductor. Conductor making good money, though. It doesn't give the top pay salary, but I know people retiring from being a train conductor. So it's a city job. They don't give trades anymore like they used to. Take your test. For those that have children and grandkids that are wondering, fumbling in their mind what they don't know what they want to be when they grow up, take a city test for something to fall back on. It's a parachute. That happened to me. One of the best decisions I've made in my life. I've been civil servant all my life. I wouldn't know what to do in private sector. I'd probably be fired like 19 times or something because my mouth, as my wife says, my mouth. What's up, Yvonne from DR? What's the weather out there? I know it's nice and hot. Don't rub it in. Just give me a temperature number. Check my temperature. Everybody, with that being said and saying all that, you just fostered the moment with Real Talk Chronicles. I'm your host, Bill Forster. That was Dr. Marilyn Corder. I shall see you Wednesday, God willing. Please take care of yourself. Keep the energy positive. Stay away from the negativity. Stay away from the buffoonery. Let your third eye watch your haters. They're disguised as friends and family sometimes, but you'll see through that, hopefully. Follow your instincts. You know, life is too short. Don't take it with you. Let it out. Shout it out. You know what I'm saying? Articulate yourself. Use your words, not your volume. I'm sure with that being said, you know, and then we talk about these relationships. Please don't be with somebody just because you're lonely. Buy a teddy bear, buy a dog, buy a cat, buy an animal, frog, whatever. I don't know what else you need to hug and shit. But love yourself, man. Be with somebody that loves you. Maybe that'll teach you how to love somebody back. With that, I'm out. Bill Forster. Chop it up with y'all in a minute. Peace.